Hello, Urbanists. My name is Alice, and it is a pleasure to welcome you to this unit, giving an overview about creating inclusive and healthy communities with places for everyone. Green and Thriving Neighborhoods is about promoting inclusiveness of the fragile population, gender equity, and women's empowerment outcomes. The local focus to implementation differentiates needs, priorities, responsibilities, and capacity to build resilience. In the Global South, informal land markets are the way in which most households get access to land and housing. Therefore, strategies are needed to address informality. The strategies presented contribute to SDG 3 on good health and well-being, SDG 5 on gender equity, SDG 8 decent work and economic growth, and SDG 10 on reducing inequalities. The overview provides tools to plan inclusive, cohesive, healthy, and affordable neighborhoods. Moreover, it shows strategies to upgrade informal settlements within cities. Part 1 is about inclusive, cohesive, and gender-sensitive planning. Inclusivity means that residents of all ages, gender, ethnicity, ability, and income groups have access to services and amenities and have equal opportunities to participate in social and economic life. This involves fostering community cohesion, planning with gender sensitivity, designing for universal access, offering diverse mobility options, improving safety and security, and enhancing reliability of public services. Cohesive communities create opportunities for social interaction and community building by providing shared spaces and services, promoting collective ownership, and by providing co-housing and multi-generational living. Public space design should be flexible enough to meet everyone's needs. Everyone navigates the built environment differently, with abilities changing across a person's lifespan. Universal design is the design and composition of an environment so that it can be accessible, understood, and used to the greatest extent possible by all people regardless of their age, size, ability, or disability. It ensures universal access to public space, infrastructure, amenities, jobs, trainings, and services. The principles of universal design are supposed to guide the design of neighborhood environment. They may be applied to evaluate places for retrofit and for new designs. The principles ensure that places are accessible to everyone regardless of their physical, cognitive, or mental ability, and that the places are comfortable by bringing a sense of safety and belonging to everyone. The design also must be participatory, that is, the design must be undertaken together with people living with disabilities. And the design has to be ecological by bringing in nature to provide cognitive, mental, and physical health for people of all ages and abilities. Design of public spaces must be clear and understandable, with very legible multisensory signage and signals to help people of all ages and abilities to understand how to move through spaces. Universal design is also multisensory, incorporating design's elements that can be accessed through different senses and provide multiple systems of navigation. It is predictable that it maintains the same clear and understandable design cues throughout a public space. It is also walkable or traversable, that is providing wide sidewalks and bicycle lanes, amenities like shops, restaurants, and medical facilities nearby, help those with limited range to manage and maintain many aspects of their lives independently. Offering various mobility options allow diverse population to access jobs, markets, and services. This involves engaging the community and stakeholders to understand the diverse needs and recognizing that women have different needs and mobility patterns. Planning with gender sensitivity takes into account that women and girls tend to be impacted the most by major environmental issues such as air pollution, biodiversity loss, deforestation, waste disposal, and exposure to toxic chemicals. Therefore, gender-informed planning sets a target for women's representation in municipal council or committees. It supports the training of municipal staff members in gender-inclusive urban planning. It also ensures the design of public spaces with a gender-inclusive participatory process. It fosters the creation of safe spaces for women for informal work and outdoor markets. The perception of safety and security can be improved by providing sanitation facilities in transport infrastructure and public space, adequate street lighting, pavements and sidewalks, and gender-based violence prevention and response services. Reliability and resilience are enhanced by access to reliable service providers, for example, energy and clean water, for all groups. These services must be resilient to climate or other events such as pandemics. Welcome to Part 2 on designing places for healthy living. According to the World Health Organization, health is a state of complete physical, mental, and social well-being. It is not merely the absence of disease or infirmity. Green and thriving neighborhoods high livability foster comprehensive health and defined by World Health Organization. Transforming housing and public spaces into healthy places create conditions which are more conducive to community well-being. Health begins in homes, workplaces, schools, and communities. The neighborhood layout shapes health choices and behaviors. Essential elements for people to engage with each other, eat nutritiously, work out, and play include natural spaces, safe streets and vibrant public spaces, healthy and affordable foods nearby. Nature draws multiple health benefits, for example, physical activity, diminished stress, longer life expectancy, and stronger social bonds. Policymakers can enhance natural spaces by providing access to nature with street trees and landscaping, investing in new parks, in greening sidewalks, and in creating waterscapes. Solutions for safe streets and vibrant public spaces can be relatively simple and cost-effective. Policymakers can, for example, widen and resurface footways, reduce speed limits, designate cycle lanes on streets or off streets using white lines or physical segregation alongside improved signage. Unhealthy foods contribute to diabetes and cardiovascular diseases in low-income neighborhoods. Policymakers can promote healthy and affordable foods by allowing proximity to grocery stores that sell fresh fruits and vegetables near homes, promoting urban agriculture to provide sources of fruits and vegetables within 20 minutes of home. Beyond nutrition, community gardens create a long-lasting social connection within the community and have mental health benefits. Groups susceptible to health problems encompasses the youngest and oldest population, those with chronic illness risk factors, and those with low income. Inclusive planning for health involves undoing disparities in how long people live and how healthy they are, engaging the community in planning and follow-up of actions, and consulting people with needs, women, children, elderly people, and people with disabilities. Welcome to part 3 of this unit, focusing on creating affordable neighborhoods. Good and affordable dwellings are essential for physical and financial security, economic productivity, and human well-being. Besides demand-side measures like social welfare allowances, policymakers can implement supply-side measures with regulatory and planning incentives. Neighborhood planning measures include avoiding the formation of segregated communities, promoting social mix and generational inclusiveness, with a minimum affordable housing supply in each neighborhood for low and middle income groups. offering diverse housing choices with a mix of types, styles, price ranges, and tenure, and also transforming underutilized inner city land and buildings into an expensive housing, financing affordable housing with development-based land value capture. Moreover, dwelling locations matter for affordability, and transportation costs impact the poorest. The poorest get hit the hardest by the lack of public transport systems. In the US, for example, in 2016, according to an ITDP survey, the lowest earning 20% of the population spent an average of 29% of their income on transportation costs. A project integrating affordable housing and public transport is Pradesh in Santiago, Chile. Affordable housing represents 30% of units, creating a socially diverse community. Pradesh is also committed to creating an equitable and healthy living environment. This includes access to amenities and open spaces like no other socially integrated project in Chile. Pradesh has 3 times the area of green space per capita when compared to the wealthiest neighborhoods of Santiago. When developing housing supply, accessibility to public transport is essential. In Pradesh, for example, a pre-feasibility study for a new transit line along Route 68, the Superspine, has proved that it is financially attainable. Moreover, it will greatly improve access to the city for this historically neglected part of Santiago. The Superspine is tied to a multimodal metropolitan transport strategy that triples the transit catchment area in western Santiago, serving over 3 million people. Welcome to the final part of this unit on upgrading informal settlements. Although every city and informal settlements are unique, some common elements of successful upgrading practices can be synthesized. These include ensuring participation, providing physical infrastructure as the backbone of slum upgrading, addressing the needs for social infrastructure, ensuring tenure security, and addressing the root of the problem by creating opportunity structures. Ensuring tenure security is a first step, as informal land markets are the way in which most households in cities in the global south get access to land and housing. Therefore, cities need to work towards formal land markets that work better for the urban poor. Policy should ensure that all households have access to different options with adequate shelter and services in suitable locations at an affordable cost. All households should have legally recognized tenure so that they have greater long-term security. Owners of property should be allowed to sell their properties at reasonable prices when they wish without compromising their future rights to safe and secure housing. City governments can undertake many interventions to make land markets function better and enhance the security of tenure for residents. Actions include engaging with residents and undertaking data collection to intervene in land markets. Reforming the formal legal state-recognized land system can make it more widely applicable and useful for the poor. Cities may also implement managed land settlement programs and support owners to undertake formal transactions. Improving the security of tenure for informal tenants and promoting the supply of adequate small-scale rental housing is an effective strategy. Ensuring housing tenure should also account for the barriers that women face. Fostering gender-inclusive housing includes to recognize the independent right of women to security of tenure, irrespective of their family or relationship status, to guarantee equal access to credit, mortgages, home ownership, and rental housing, including through subsidies, to guarantee the right of women to participate in all aspects of housing-related policy making, including housing design and construction, community development and planning, and transportation and infrastructure. Affordable housing can transform informal settlements. The dwellings in Lubanche, north of Santiago, Chile, for instance, were raised in two phases and developed to rehouse most families living in two large informal settlements. The project's premise was to ensure that the families could stay in their usual areas of residence, close to their workplaces and schools, avoiding the risk of social exclusion. To make the best use of land and avoid overcrowding, the house prototype proposed goes up 3 floors and can be extended inwards. This project in Quinta Monroy, at the time one of the last informal settlements in Equis centers, shows an incremental approach to affordable housing provision. The first decision was to stay on the same terrain. Land costs 3 times more than the land usually assigned to social housing, but this avoided having to move those already living there to the periphery, where land is cheap but where the location can lead to marginality. The subsidy of $7,500 for each family allowed buildings at best 36 square meters, half the area of a standard middle-class house. The incremental project typology makes an efficient use of the land, permits extending the houses in a controlled way to avoid overcrowding and promote self-building processes. Families are given half of a good house equipped with quality services, and they are offered technical support to carry out the extension on their own. To conclude, let's summarize the key lessons from this unit. The key takeaways are: 1. Inclusive design ensures that residents of all ages, gender, ethnic, ability, and income groups have access to services and amenities and have equal opportunities. Natural spaces, active travel in safe streets and vibrant public spaces, healthy and affordable food nearby, fitness options, all ensure health and well-being. Good, affordable, and diverse dwellings in well-connected places are essential for physical and financial security, economic productivity, and human well-being. And lastly, ensuring participation, providing physical infrastructure, addressing the needs for social infrastructure, ensuring tenure security, creating opportunity structures are key for upgrading informal settlements.